Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Can medical providers help treat the health of the planet? On today's podcast, Stephanie Desmon talks to Chris Lemon, an ER doctor, exploring the intersection of human and planetary healthcare. They discuss Lemon's plans to train doctors and nurses to better communicate to patients about the dangers of climate change and air pollution to their health, and to reduce the massive carbon emissions produced by the healthcare system. Let's listen.
Chris Lemon, thanks so much for joining me.
Pleasure to be here. Thank you for having me.
I wanted to talk to you about sort of your unusual role. You're trying to bring the planetary health dialogue to doctors, to nurses, to healthcare providers. What does that mean?
It's a great question. So what I'm trying to do is help the medical community and the nursing community realize that there's a lot more work to be done. I think a lot of us are burned out as a result of COVID or are coming into this profession as a result of COVID. And either way, there's an interesting moment occurring right now where I think that we have people looking for a sense of purpose and a sense forward for society. And we're also in a situation right now where our planet's health is failing. If this was a patient that we would be reviving, we would consider the health of this individual to be critical. So we can't ignore the vital signs of the planet right now. And I think that clinical providers have much more breadth of knowledge and communication skills than they may realize. So we're trying to wake them up to that.
And how does that fit into medical practice?
So planetary health, even just to touch on that for a second, is this transdisciplinary framework that human activities in the environment are ultimately going to impact our own health. And this is everything from climate change to water quality and air quality, global pollution. And so as we start to think about the ways that people are impacting their environment, we have to realize that as medical providers, we can't get away from that. So everyone in the healthcare community, and that's not just to say doctors, but nurses have a role to play in this because our patients are coming in. I live here in the mid-Atlantic and my kids went to outdoor summer camp last year. And I never thought that I would have to be worried about them being outside on code red and code purple air quality days because Canada is burning. And so what we have to realize is that every patient we see is going to be vulnerable in some way to planetary health threats.
So what's an example of that?
So I think just going along what we were just talking about, the air quality issue in the United States and kids with asthma, or the fact that pollen seasons are going to get longer by several weeks and what that can do to people with airway triggers. When we talk about the heat waves that we experienced last summer, the fact that that's going to exacerbate cardiovascular issues and stroke potential, renal failure, all of these things are related to the environment. We start looking at zoonotic diseases and vector-borne spread, malaria and dengue in places where it hasn't been in a long time or never before. I'm getting alerts on my phone about these issues, and I'm having to double check myself that I just read that P. falciparum was detected around DC last year. So all these things are emerging into medical practice, and I think that's where we need to wake up to the reality that nothing's going to be the same after COVID because there are other wheels that are already turning right now.
So you're an ER doc, and it's really busy in the ER. How does this come into a conversation in a meaningful way?
It's amazing. We talk about how we have to move so quickly and get through things, but there's always time for more communication. And I know some people, if they're clinicians listening to this, may be groaning about that. But honestly, when we're talking to patients about what's causing their problems, that's something that we're meant to do, is to get to the bottom of that. We all learn social determinants of health, and these environmental and ecological social determinants of health are the same thing. So when we're talking to our patients about the fact that it's hot outside and we need to be thinking about side effects of their medications, be they for their cardiovascular or psychiatric systems. These are things we're trained to think about in some regards, but they're things that if we don't bring to a patient's attention, they could suffer sequela in a much worse way. So we need to be trained to talk to patients about the fact that if it's hot outside, we're thinking, do they have access to air conditioning? For a public health audience that we're listening right now, I'm going into public health as a cross training because I think what you all do is so valuable. A clinician can say what's important in the moment, but we need that bigger scope of public health to really make an impact.
But if the air quality, if there's a fire in Canada and I can't see the sun, what am I supposed to do about that as an individual?
Yeah, so that I agree is when you're talking to somebody in the context of them being sick in front of you, the goal is not to start lecturing them about taking a flight to somewhere or, we want to recognize the fact that this is a space for healing. But I do think it's a moment for that light bulb to go off for them that, these are issues that they are empowered to do something about, whether it's voting a certain way, being an advocate in their community, especially religious communities, honestly, are some of the biggest allies in paying attention to being good stewards of the community. I think it's these stories that we get, being able to communicate to patients that my kids are outside choking in this air as well. I can relate to you. Or if it's not impacting you, you have a family member who's probably being impacted due to some underlying condition or vulnerability. These small little tidbits that just make these links and connections for folks, I think start to go a long way because if it's in Canada, you're right, it's not going to be real to you. But if you're drawing that connection to the health of you or your loved one, suddenly it hits much closer to home.
So you're working to train healthcare providers in what?
I'm faculty with the Department of Emergency Medicine at Johns Hopkins. So I'm working with residents and medical students within the context of the emergency department. But emergency medicine, as you know, interacts with all the different disciplines. We're constantly calling for consults and help and admitting folks. And so it's a great way to interact with the hospital at large. What I'm also trying to pivot and now do with my role as the faculty director of clinical programs at our new Johns Hopkins Institute for Planetary Health is find ways to kind of give that even more in-depth deep dive for people who are more interested in this. So we're looking at building out a clinical fellows program. And again, that's not supposed to be just for physicians. We want any clinicians, and that includes nurses, being brought into this with regard to the fact that if you're interested in pursuing this, can we give you the skills and research and policy and advocacy communication that you can go on to be a leader in this field from the standpoint of the healthcare sector?
You're also trying to make healthcare more sustainable. Talk to me about that.
Super. That's the easiest one I've got, right? So healthcare in the United States is responsible for about 8.5% of our carbon emissions. So we are huge. And it doesn't mean that the work we're doing is bad. We shouldn't be thought of as bad people for trying to help people, but it's something where it means we have a responsibility to do our part to try to get through this crisis. And so we're doing a few different things. I'm working with the Sustainability Leadership Council on healthcare at Hopkins, but also working with the National Academy of Medicine's Decarbonization Catalyst program to look at how do we decarbonize the US. And I'll also I was just at the Planetary Health annual meeting. So I admit I flew there, but I thought it was relevant and important. It was in Malaysia. But when I look at what some people are doing around the world, it's absolutely astounding, in some regards, how far ahead other countries are in working on sustainable healthcare and taking that mindset of planetary health. And so I think we have a lot to learn from one another. But the one fundamental thing here is we really do have to come together as a healthcare community in order to get through this together and try to reduce our ecological footprint.
What are these countries doing?
So, it's everything from waste streams, looking at single-use plastics and recycling programs, to where we're sourcing energy from and energy inputs into our system, how our engineers are brought into these discussions. Like we were saying, I don't know that it's the right place for a doctor to be yelling about a light bulb being LED, right? There are so many minds that go into running a healthcare system that it's how well are we communicating between all these disciplines and coming together on this. And I know that kind of goes back to what we were talking about. I see healthcare clinicians as being a communication mechanism, a voice that connects these problems to healthcare, but the health system is so much more complex than that.
So I don't think of hospitals as being the big polluters. What is it about hospitals that is emitting so much?
But we use a lot of energy 24/7, 365, right? All the lights that are on, all the machines that we're running, all the labs that we process. And then you think about all the plastic waste that comes through when we talk about things in terms of infection control, how we handle hazardous waste and incineration. And it becomes very apparent that for every patient that comes in, for those of you listening who are in any sort of clinical space, the number of touch points where a single patient has energy and waste expenditures as a result of the tests and processes that we go through generates a tremendous amount of waste. And so again, there are certain things about healthcare that are tremendous, and you can't get by that. It requires energy. It requires waste to keep people healthy in these situations. But I think all of us in healthcare can also think about, do we do things every day that may be wasteful beyond what we need to take care of our patients? And that's what we're trying to drill down to right now.
Now, you are an ER doctor. Is that why we're focused on the ER? Because that's where you come from? Or is there something specific about the ER that needs this kind of conversation?
So the ER has its challenges, of course, just like all sections. I happen to be from there, so it's a lot of what I talk about, but some of my closest colleagues are coming from places like the operating rooms and anesthesia. So certain types of synthetic anesthetic gases have much higher potentials for global warming than carbon dioxide. And the same thing in the operating room when you think about waste streams and single use and plastics and such. Some of our biggest advocates, like I was saying, are not just in the emergency department at all. It really is a collective effort because, again, we go back to this idea of expertise. We're experts in our own fields. We don't pretend to be experts in those of others, so we need to be working together.
If there's one thing that you want patients to come away from this conversation knowing, what would it be?
That they are going to be impacted by planetary health issues in terms of how we're treating our environment. And at the same time, that they have the ability to make things better by being a voice, by being an advocate, by being active in their community, and by realizing that we're talking about planetary health as how humans are interacting with the environment and impacting natural systems. If you are a human on planet Earth, you have some interaction with this, no matter who you are or what you do. So some of this is personal choice, but some of this, even maybe more importantly, is how you represent yourself and your ideas in your community to work on these issues. So know that you are vulnerable, whether you like it or not, but we're all vulnerable, and that we can all do something about this if we choose to.
It all feels like something a little bit abstract and a little bit in the future, right? So how do we sort of give the sense of urgency that is needed?
The reason that I came back into this was because there's not time to wait for the next generation of folks to come in. I've been out of residency for about 8 years now. The COVID was my reason for turning around. It was the wake-up call that I needed to realize that we are all more vulnerable and our healthcare systems are more fragile than I think we realized prior to the pandemic. And so if we're going to talk about sustained stressors and the impacts on the future, I don't think we need to look much further than looking backward to the pandemic and how we all experienced and felt during that time. That was our sense of urgency. That's the wake-up call here, is if we don't want to repeat some of these same problems as a society that we just went through, we need to realize that we need to be acting now.
And some might ask how COVID is an environmental issue.
So from a strictly scientific standpoint, the concern is we start to push further in terms of the natural boundaries in the world. We could be facing more pandemics if we have more zoonotic diseases. That's something that One Health has been talking about for a long time, and their concepts have continued to evolve. But on top of it, I think you're realizing as well that COVID and the environment was a wake-up call for how we interact with the environment. When you have that sort of disturbance, all of a sudden, things like our supply chains were completely disrupted, people's livelihoods and jobs, how we interacted and communicated with each other. So going back to that planetary health framework where everything's interconnected, COVID was a great example of how an infectious disease could disrupt every aspect of our lives and our connections to one another. And so we're all part of this environment. We've evolved in this environment, and we're going to live in whatever environment we choose to give ourselves going forward.
Chris Lemon, thanks so much for joining me.
It's an absolute pleasure. Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Grace Ceciri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Cesiri and Eliza Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.